Okay, we might begin. So let me begin by acknowledging that I come to you today from Ghana land and I pay my respects to Ghana elders past and present. This land always was and always will be Aboriginal land. And in the spirit of paying the rent, I would like to point you all to some Aboriginal and Torres Strait Islander content. And in particular, this week, I have been loving listening to an episode of the Speaking Out ABC podcast hosted by Larissa Brent, in which she's interviewing the new National Commissioner for Aboriginal and Torres Strait Islander Children and Young People, Sue-Ann Hunter, and Snake CEO Catherine Little. And we'll post a link to that in the chat. But I encourage you to have a listen and really understand kind of the voices of those incredibly important women in our First Nations conversation. So thank you so much for coming along today. I really appreciate everyone making the time. We're here today to profile a really exciting story. It's a story of a serious and sustained engagement by a government in the idea that you might actually want to build a child protection system that learns what is working and that is informed by multiple kinds of evidence, from population level data to lived experience to practice judgment. And I'm a pretty experienced public servant. My name is Caroline Crozaballo. I'm here at the Front Project. And one thing that I've noticed when I've seen how systems do things is that they tend to have one kind of evidence, but not all of them. And what you see when it comes to the child and family support system in South Australia is that by bringing together all of these different kinds of evidence and building that learning system, the system has credibility with all of the different actors involved. And that's like from the Treasury through to the social workers on the ground, through to the families receiving the services. So look, before I begin, I thought I might just introduce our wonderful panelists. So today I'm very excited to have joining me Dr. Henry Faro, who is the Director of Pathways Evidence and Partnerships at DHS in SA. And Henry will be speaking in a little bit about what this system has been like to design from inside. We're also joined by Jessica Burnage. Now, Jessica Burnage joined the Lived Experience Network, which we'll be hearing about in early 2024, and she is driven by a strong passion for elevating the voices of children within the child and family support system. And finally, we're joined by the excellent author of this case study, Dr. Ryan Martin, who is a policy analyst at the Centre for Policy Development. But before they all get their go, I am going to take Chair's prerogative and do a little bit of setting up kind of why we're here and what I was hoping to do with today. So look, I actually first got involved in child and family safety systems when I was a public servant working back in the Department for Education in South Australia, and I was heading up an early years and child development division there. And I learned about CFSS when a bunch of social workers called family pracs, who had been working for DHS, but they were in some of our education children's centres, were pulled out during COVID. They were kind of pulled out and they went to work on Henry's Pathways team. And they started doing the work on capturing intake data, which forms the basis of so much of the rigour of what you're going to hear about today. And like all change, it's fair to say, and especially change done quickly and during COVID, which wasn't like a great time for people to be resilient to change, this move prompted a complete outcry. So the first I learned about the child and family safety system was children's centre directors calling me and saying, what on earth is going on? And I mention this story because you're about to hear a really positive story about the system that has been built. But I want to remind people that, like, it's hard to build new things. And one of the things that's really incredible about CFSS, I think, is that it's been done with this kind of constant openness to reflecting on what's happening and learning and adapting. And that makes it much more resilient to change than I think other kind of set and forget programs are. So the end of the story of pulling all those family pracs out into the Pathways service is that actually you'll see that this Pathways service has become really integral to kind of how this system operates. And our children's centres have kind of come up with different ways of operating without having that service on the ground. And that's another thing that I think is really important for us to always think is we're always making choices when we do things in policy land. And I think some really smart choices were made in child and family safety systems, but they've also been backed up with kind of rigorous evidence, thoughtful design, and clarity of purpose in leadership. So that's why I'm fascinated by this case study, because it's not easy. It hasn't been easy, but the results are really worth it. And I look forward to you hearing all about it. So today you're going to hear from our panelists. We're going to start with Henry, who's going to talk a little bit about what has been happening in the system, and then we'll move on to Ryan to sort of say what his insights from the case studies were, before we hear from Jess to talk about the lived experience network. And then at the end, we're going to have a Q&A. And so please feel free to put your questions in the Q&A. But Henry, I am going to start with you. What is the child and family safety system? Like, what is it? Where does it fit? What is it aiming to do?
Thanks, Carolyn, and thank you so much for putting this on and having us along today. Look, I think some of this information was included in the case study, but I can obviously elaborate a little bit more in this space. Fundamentally, we're a system that has been purposefully designed to support children and families when they're experiencing challenges in their lives. We are statewide. As you can see in the diagram, we talk about the system as consisting of both high intensity services and family support programs, which are kind of a lower intensity. We talk about our system as being secondary targeted. So what that means is it's not available to everyone. We are working with specific cohorts, specific populations. And to be a little bit technical, we primarily talk about our cohort that we're trying to work with, children and families who are at risk of deepening contact with the child protection system. And ultimately, what we're trying to do is find ways to get to these families early, provide them with the support that they need, do so in a way that's kind of holistic and inclusive and non-judgmental, to ultimately improve their circumstances, improve that child's well-being, and ideally avoid them having further contact with statutory services like child protection.
So can you give us a sense of scale? Like you said, statewide service. So kind of how much money, how many providers, kind of how many families?
Absolutely. The total budget's about $60 million in total. We are statewide, I think, and we talk about this a bit in the case study. A key part of the system design is it's this hybrid model where we've got both government and non-government working in partnership alongside each other, delivering the same services. So it's not like government does this thing and non-government does something else. We are all delivering a uniform service model across the whole system. It's made up of about 25 providers, of which government is about 50% of the service footprint, remaining 50% is non-government and ACOs. And we have made a very clear policy commitment as part of our commitment to closing the gap, that 30% of all of our commission funding goes directly to ACOs, because that's the proportion of children who are overrepresented in the child protection system, in our referral system. So we've made a very purposeful investment in that space.
Yeah. And what is the process? So you talked about the targeted system, so it's not available to everyone. What's the process by which families kind of end up in the child and family safety system?
Yeah, sure. It's a bit tricky to kind of answer this simply because we've got those two streams. So things are different depending on what part you're talking about, but I'll try and cover both. So when we're talking about high intensity services, which by the by makes up the bulk of our service footprint at the moment and is the majority of our investment, those referrals are from targeted agencies and other government departments primarily that we've identified as having a referral pathway in. So namely, it's SA Health, Education, Child Protection Services, and also something called MAPS here in South Australia, which is the Multi-Agency Protection Service. So those agencies can refer families to us when they've got concerns. And a team that sits within my directorate then receives and processes and triages all of those referrals to try and inform our decision making around who to prioritise with what is an overwhelming number of referrals, more than we have capacity to ultimately get to. Contrast that with family support services, which are designed to be an earlier entry point. And so primarily it's a self-referral pathway there. Families can seek help, whether it's through community development coordinators, parenting support workshops that we run, and then also some targeted lower intensity case management services. But it is a self-referral, self-help space, noting that a lot of the time it might be an assisted referral that happens as well. So someone might be engaged in some other type of support, and then it's like, hey, you might benefit from this thing over here, and they're supported to engage in that self-referral pathway, if you like.
And so a family is referred in primarily because this is in that higher intensity space. How does families exit, or how do you know what success looks like?
Well, the first thing is we want to be sure that, like I said, we are making a conscious decision around who we do prioritise for service delivery. So there's quite a rigorous upfront process to kind of triage, process referrals, work out what our ultimate goal and plan is with that family as well, based on the information that came in during the referral. I mean, then the reality, particularly when we're talking about our high intensity services, is most families' first experience of the support is a random stranger knocking on their door or approaching their school saying, there are concerns about you and we're here to offer help. Which, I'm sure you can
Ooh,
imagine, as I'm sure people on the call can imagine, is a
yeah,
very confronting thing to hear.
yeah,
Um, so I stressed at the start, holistic and inclusive, and I cannot stress that enough. Like there is such an art form to the way and clinical rigor in the way in which our family practitioners approach those conversations to do it in a way that's non-stigmatizing, non-judgmental, and really is seen as an honest support service, not one that's aimed to maybe make people feel trapped or tricked or something, which
yeah.
often is the perception that we might face. So I say all of that just to set the scene for then what happens is obviously once engagement has occurred and we've got agreement that the family do want to engage in this support, there's a really kind of back and forth process around setting case plan goals, monitoring those goals, understanding how progress is being made against those goals. And so fundamentally, the majority of all of our cases, your question was how do people exit, is once an agreement's been reached between the practitioner and the family, that the goals that we set at the start of this journey have been achieved, and we are feeling comfortable that you've got adequate safety planning in place, and you've got support mechanisms in place, that the things that were of concern at the start are now mitigated to a large extent. So fundamentally, that's the way that people exit, an agreement that goals have been met. There are also, and it's important to note this, times in which we might have to escalate cases to tertiary services as well, such as child protection or police, and maybe corrections might become involved as well. So those are probably two of the most often. And the third one is, it is ultimately a non-statutory service. So families are not compelled to engage with us. And sometimes families will choose to self-opt out as well and decide that it's not for them. And that's okay. And that is supported ultimately. But with that comes a real, and again, necessary point for our practitioners to have honest, open conversations with families about what that means in terms of, their need to report these types of matters and those types of conversations as well.
And so finally, in just scene setting, how do you measure we're going to talk about the functioning of the system. How do you measure what good is looking like, or what are you looking for when you're thinking about whether things are working?
And I can answer this from a data perspective or a human perspective. I'm going to do both. I mean, ultimately, the vision of our system is that children remain safe and well at home, connected with their family, connected with their community, and connected with their culture. So how do you measure that? It's not an easy thing to do. The answer is really the case study that we're sharing with you today. We've created a whole learning system and a whole purposefully designed data system to try and capture that whole thing. How do we understand whether or not we're achieving those outcomes with families? I won't go into all the details other than to say what we do at a high level is we ask our practitioners when working with families to assess whether or not we feel like safety has been achieved and whether goals have been met. So there's a whole lot of kind of practitioner loaded assessments that occur during the course of a support episode. And then the other thing that we've done is link all of our data to long-term data assets. And so we're really interested in looking at whether or not a family that engages in our services ultimately comes back into contact with other government departments later, such as child protection, education outcomes, health outcomes, etc. We're very early in that journey, but the case study did highlight our first set of outcomes data in this space, and we're really pleased to be able to say that we are achieving very high rates of out-of-home care avoidance or family preservation, upwards of around 94% of all families that we work with.
Yeah, that was when I rediscovered this work, was when someone mentioned that stat in a meeting I was in, and I was shocked at how good a rate of family pres that is. Can you talk a little bit about how this approach is different from the way that government typically does kind of research and evaluation? Like, I feel even weird talking about it as a research and evaluation question.
Yeah, and I always struggle to do this justice because I think at the end of the day, I'm probably a bit of a data nerd by heart, so I naturally gravitate there, but I'm going to do my best to try and present more than that. So the first point I really want to make is, and it's in the case study, that the learning system that we've created is so much more than just data. It's not just about measuring some outcomes or some outputs or some particular metrics. That is a fundamental component of the whole thing. I don't want to shy away from it, but we've set this up from the outset to include lived experience, and you'll obviously hear from Jess later, practitioner insights and practitioner wisdom, First Nations knowledge and cultural leadership, and all of those elements and system observation as well come together to help us understand whether or not what we're doing is linked to and achieving the outcomes that we want it to achieve. And that's really fundamental to this approach and different to anything I've ever seen anywhere else in government, I think, to try and apply all of those lenses, at least here in South Australia. I can't speak for the whole country. So that's the first point. It's a lot more than just data. It is that whole wheel coming together. The other point that I really want to emphasize in terms of what I think special about this is the fact that we did, and it's lucky, I guess, we were in a fortuitous situation to be able to build this thing from the ground up. But we took that opportunity. And so what we have created is really purposeful measurement from the outset, of this system design, which, by the way, I didn't mention it, but has only really been in operation. You kind of highlighted at the start, since about 2020, this system's been in operation in South Australia. And so we created what we measured with real purposeful intent around ultimately what we wanted to understand. So that long-term planning around what we're measuring and analysing. And then finally, again, the case study, I think, does a beautiful job of highlighting this, the approach that we've taken to doing this in partnership with all of our sector partners, both government and non-government, and that real relational contracting approach that we adopt, shared understanding of learnings, reflection on those to ultimately implement the way that then translates into practice and system operation, I suppose.
Yeah, and that segues actually nicely. Sarah Ryan has asked a good question about whether you ask families or clients for their experience of the services and outcomes changes they experience and whether that feeds back into the system.
It's a great question. Thank you, Sarah, I think you said. We do. It is also definitely on our reform list to drastically improve the way that we do that as well. So there is a whole lot of input that families will have during the course of their involvement with a practitioner about how it's going and providing feedback. We're a bit light on, to be frank, in terms of our structured data tools, and it's on our to-do list over the next couple of years to build that in a more structured way. So it's a really great question, one that we recognise we need to do more in, but we do our best to capture that through the voice of our practitioners as well, where it is available.
Yeah, and I love that you mentioned structured data tools, because one of the things maybe we haven't been clear is that you have a very multidisciplinary team, right? That you have teams which are used to thinking about how do you rigorously capture this kind of data. And that's a really important part of your process as well, hey?
It is, absolutely. I mean, at the backbone of this was some very kind of purposeful design from an epidemiologically informed approach. So we've got a team of epidemiologists who work within our directorate who have helped shape this. But it's actually before my time when this all got set up. But what happened was it was kind of epidemiology coming together with family practitioners, coming together with lived experience, talking to the sector at large to say, well, here's what we want to try and achieve to understand these outcomes. How do we want to do this in the right way? And so it has really been a multidisciplinary informed approach to building this learning system and the way it's operating these days.
And look, a quick final question before we throw to Ryan. Like, how is it hard? So I said up front, I had experience of it being hard, like right at the beginning. What are some of the challenges of doing this kind of work in a bureaucracy?
Yeah, it's a great question and a very real one as well. Look, the first thing I'd say is there are definitely a lot of benefits. I don't want to come over, turn a negative into a positive, but we can achieve a lot of influence in terms of implementing changes to service delivery approaches and influencing policy by doing this within government. One that I feel like we have a bit more agility to be able to do that than you might if you were sitting outside doing research. So that's kind of the silver lining to it, but definitely there are a number of challenges. To name a few, the pace at which we might want to operate doesn't always align with the expected pace of government. And that actually can go both ways. Sometimes research doesn't move anywhere near fast enough, and people want results and they want them today. And we're like, that's 6 to 9 months of, targeted analysis before we might be able to answer that question. So definitely that challenge comes across. But I've also experienced the complete opposite, where we have a finding that we're really interested in, but the timing's not right for us to necessarily explore that in line with, policy cycles or current, what might be the areas of focus for a government or a department. It means that sometimes your timing just doesn't quite work. So that's definitely a challenge, and one that I think I counsel my team on regularly in terms of just understanding how to operate within a bureaucracy. Look, I could talk about a whole lot more. I think the other one I'd touch on is, sometimes the results don't necessarily tell us what we want them to either. And so you might get a finding that's either ambiguous or null, it doesn't really tell you much. If you're sitting out in research world, you're probably quite used to dealing with null findings, but I think there's a little bit less of an appetite from within government of asking a question and getting an answer back that is, oh, we don't really know. So that's definitely a challenge as well. And then the final one that I'd kind of finish off with is, I guess, linked to that. Sometimes we can find when doing this work, understanding outcomes, understanding, practice implications, that some parts of the system might not be operating in the way that we ultimately want them to. And then we still have a responsibility as system stewardships to maintain relationships and do so in a kind of, relational contracting approach, partnership approach with the whole system. I'm not just talking about non-government or government here, to make sure that, we might be addressing something that we're seeing, but not doing so in an adversarial way as well. So that can definitely become a challenge as well, as terms of how do you deliver those messages and have those tough conversations with people when we're finding something, but not do so in a way that it becomes kind of adversarial and ultimately people switch off from the learning approach, I suppose. And I'm really proud to say that I don't think that is happening. I think our sector partners would be a testament to how collaborative this is, but it is an ongoing area of focus, I guess.
Yeah, it's so funny. I think government bureaucracies can get very caught up on the idea that they need to kind of hold a really tight line on accountability. But then when you see something like public schools or public hospitals, you see that in fact inside government, we have a much more kind of open and learning approach to service delivery partners, because we know you can't just whack people. So
Absolutely.
Yeah, it's been great to see that kind of real sense of partnership. I'm going to chuck to Ryan now, and we'll come back for some questions at the end.
Thanks so much.
Thanks, Henry. All right, Ryan. So why is this learning approach in CFS so important that you guys at CPD wanted to write a case study on it?
Well, the first thing to acknowledge is that people have long known, practitioners, communities, even people in government have long known that the way that a lot of different social services are designed doesn't really put learning at the center. There's often a big focus on compliance, and Henry talked about how they're doing contracting differently. That's one example of that. There's also often, the evaluations are often one-off rather than continuous. That's another thing that the CFS does differently. And often evaluations, because there's so much about accountability, there isn't always actually a really strong, it doesn't actually really improve the evidence base sometimes for certain policies. So there was a report by the Committee for Economic Development of Australia back in 2023, and they looked at 20 different social services policies and evaluations, and they found that only 1 out of the 20 had actually been, in their opinion, evaluated properly. So there is like this long-standing kind of problem that service providers know, communities know, governments know. But the good thing is that governments are actually starting to attempt to do things differently. I mean, obviously, this particular case is a great example of that. But we're also seeing at the federal level, like the Federal Minister for Social Services, Tanya Plibersek, is really keen on doing contracting differently, trying to take that relational approach. There's the Australian Centre for Evaluation, which has been around for a couple of years now, and they're really trying to build out the evaluation capability across the government, and they've partnered with the APO, I think it is, to release a bunch of government evaluations to the public and things like that. So the government is, and governments across not just the federal government, but across all the different jurisdictions, are keen to do things differently. They know the problem. And I think this case study is a great example, or what we hope at least is going to be a great example of giving them ideas about, this is some of the things you can do. Here's some lessons here that you can apply to your own jurisdiction to try to make the way that you design and deliver social services to really put learning at the center of what you do.
Yeah, what do you think the key lessons are that other governments should take from this case study?
So in the case study, we have like a section at the end, which is the 6 key lessons. Feel free to read in more detail, but I'll try to explain them succinctly here because I only have so much time. I think one I'll start with is what Henry mentioned around combining different sources of evidence. So not obviously Henry talked a lot about the really developed data system and like that epidemiological analysis that looks at the population level outcomes and things like that. But they also take lived experience really seriously. So Jess can talk about this a little more later in the webinar. But they have a lived experience network with a bunch of system advisors of people who have had experience with child family services and different kind of events like that are in like a really great place to provide feedback to the system and do lots of great things like giving feedback on the data collection tools and training and meeting regularly with the executives and things like that. So they're genuinely integrated into the way the system is developed. They also draw on the practitioner wisdom and knowledge as well, including First Nations practitioners in particular. So part of that comes through the relational contracting. So rather than contracting just being about compliance back to the government, those conversations, and as part of the case study, I spoke to not just people in the Department of Human Services, but also some of the service providers as well. And there was agreement across everyone I spoke to that those conversations aren't about like compliance. Like there are compliance elements because it does need to be a certain minimum level of like, data you're collecting, things like that. But they're really more about, that two-way exchange of feedback, the government coming in and giving advice to service providers to improve practice, but then the providers giving feedback back to Henry and others in the system about how they can do a better job of stewarding that system. And that's a really good example, not just of combining the data, but making sure it's that continuous feedback loop, right? It's not just the data they put out on an occasional report. It's all ever going in the contracting conversations. They have communities of practice to distribute this as well. Another, sorry.
No, I was just going to say, I love one of the things that I've noticed is the way that the kind of different sources of data help prod different conversations. So I remember there was an early conversation around family engagement rates, and it led not necessarily to kind of a black and white, you must do family engagement in this way, but it led to a really detailed practice conversation about what are the best kind of factors that support engagement of what kinds of families. And I just think that's kind of that nuanced learning conversation doesn't happen in you haven't met your 90% target of blah.
Absolutely, yeah. And like, yeah, there was data around sort of which engagement methods are most likely to convert into like a referral into someone who's receiving services. And yeah, there was that data, but then they combined that with the conversations with the practitioners to figure out what is the best practice and really improve the practice across the system as a whole. Another aspect.
Now, I have realised, sorry, Ryan, I have realised we have dramatically underestimated how much time we're going to take on this. I would like us, because I want to get to Jess,
Sure.
could you maybe just finish off by talking about what are the factors that you observed that allow CFS to do this kind of quite different work?
For sure. I think a really big one that I heard from everyone I spoke to is the leadership, both the organizational and political leadership, and how they responded to crisis. So, I mean, if you don't know, the child protection statistics in South Australia are worse than other parts in Australia. And in 2016, there was a Royal Commission into child protection that, made really clear you have to do things differently. And I think it's easy for governments to kind of just dig their heels in or like do a short announceable that looks like they're doing things differently. But in this situation, they actually really listened and they tried, Henry just talked about how they created this new system from the ground up. And that leadership has also filtered into just the general culture of the government and the service providers and things like that. A culture that really values diverse perspectives, that really values listening and using mistakes as a chance to improve and not to get defensive around it. That culture that puts learning at the center rather than just accountability to the government. Another thing that I think was a really big enabling factor was the actual really focused investment from the government in the learning structures. So, these data systems are expensive and they require a lot of IT systems and data storage and data security and things like that. The lived experience network, and I'm sure Jess can talk about this a bit more, like they have a dedicated coordinator to help all the people with lived experience. the communities of practice. You know, every year they put on this big statewide forum for the practitioners, and that has a dedicated budget to make sure it's free, to make sure everyone can access it. So really, and it's not just like a one-off investment either. Like these need to be continuously invested if you really want to invest in these learning systems and make them effective. So that's the other sort of major factor I would say.
Yeah, and it's the easiest stuff to cut when it comes to budget savings, and it's very impressive that they haven't done that. I am now going to jump to Jess, bring Jess on screen, because Jess, you are a participant of the Lived Experience Network, and I guess we're so pleased to have you here to share kind of what is the value of lived experience in the CFSS learning system? Like, what do you and your counterparts bring to the conversation?
Thanks so much for having me. Look, I think lived experience is a really great way to finish a piece of a puzzle. It works alongside data, alongside statistics, practitioner knowledge, and cultural knowledge. And Henry touched on it before. I think bringing all of these parts together really gives us a more holistic understanding of what is and isn't working within systems. And I find that lived experience can offer a different view of data than just policymakers or system designers, because it really focuses on how the system works on the ground level for the families and where the gaps and failures are within that. And I really see this perspective challenging unconscious bias. It can challenge unconscious bias within the system learning because it really reflects what's happening on that ground level for service users through real stories and, like Ryan touched on, in-depth case studies. And then whilst professionals bring their own lived experience, I see the lived experience of the families using the CFSS system is really unique because it comes without clinical influence and it's being able to be heard directly from those families themselves. And then I see the insight coming directly from the families. It really helps build a deeper understanding of how people can end up in certain situations and how hopeless things can really feel in that moment. And I see LEN as the mechanism within DHS that creates space for the voices within the learning system. And with us being system advisors, we're able to bring our lived experience expertise, which feels like that last missing piece of the puzzle. And it helps keep a human face to the families within CFSS alongside the evidence and the data. And it can help the system to ask better questions, like how are the services can better wrap around and really support those families in the times of need. I'm not saying that lived experience is the only answer, but I truly feel it's essential to work alongside the work of the practitioners, the stakeholders, and the policymakers.
Yeah, and I think I love that the kind of surfacing the human face, right? Like it can be so easy when you're in a room full of kind of other professionals to be like, oh, they're the problem. It's definitely not us who's the problem. But can you bring us, I think you might have a good example of how that frontline service changed, where the Lived Experience Network has actually been influential in shaping how that service is delivered?
Yeah, I'll throw a few statistics out. In 2025, we actually did 11 major consultations with DHS and external stakeholders regarding CFSS business. And in 2024, we did 16. We do our quarterly governance meetings with our CFSS division leaders, and our most recent one had a focus on Aboriginal and cultural governance. We've worked on things like communities of practice, a royal commission into the domestic, family and sexual violence, helping them shape their Share With Us consultation tool, which was supporting the impact on DV on children and young people and was rolled out for everyone to be able to utilise. Something that's quite personal to my heart is I did a professional developmental video with Safer Family Services, where I was able to talk about my childhood experience and really hopefully elevate the voice of the child within CFSS and the learning systems to make sure that children aren't slipping through the gaps anymore. And that video now is actually rolled out in part of the induction process. And from that, I received a really great feedback from a Safer Family Service practitioner who said that they had responded differently as a direct response of listening to my video with sharing my experiences, and it helped her respond more empathetically to a child's disclosure of maltreatment.
That is that is so incredible. And I think, I was going to ask you and interested to hear you to be able to contribute to the Lived Experience Network and CFSS. And I can sort of already hear like it's that sense of kind of connection of actually impacting what's happening, right? So what's it meant for you?
Absolutely. I mean, through my childhood experiences, I often really didn't feel heard or validated or taken seriously when I was talking with practitioners. So, as an adult now, being able to be in a space that allows me to reflect on those experiences and to see people's genuine engagement with the policymakers from the DHS staff, it's been really powerful and healing for myself. And having my experiences acknowledged has been deeply empowering and healing. And then I'm being able to give a voice to the children and speak to what I really needed in those moments. It's been incredibly satisfying to feel like I'm supporting those children who feel like they don't have much of a voice in their current situation. And being able to focus on the child's voice offers insight that you can't always get at the time because the children don't have the words yet. Sharing my lived experience now with what worked and what didn't and what support was missing, I feel like has had a real impact within CFS learning systems. And using that insight to create understanding and change gives meaning to what I went through when I was younger.
Oh, Jess, thank you so much for sharing that. And I'm so pleased that it's been such a supportive process as well, because I'm sure, like sometimes people can be a bit tokenistic in how they bring in lived experience, but this just feels like so deep and sincere. I'm going to bring everyone back onto the screen now and encourage people to submit questions. And we've got a first question for the fabulous Thea Snow, who says, "This is a fantastic initiative. Thank you." She's wondering who defines what a good outcome is. Do families or clients have a role in defining that? And I guess, Thea, I'm going to get all annoying on you and say, isn't one of the questions who defines what a good outcome is for who, right? Like, are we talking about a good outcome for government? Are we talking about a good outcome for the families? But Henry, I reckon you might be the first person to go to on this one.
Yeah, for sure. Look, I think the answer to that is multifaceted. I think at a system level, we designed our outcomes and an outcomes framework that was completely informed by, well, the Royal Commission, I guess, that Ryan touched on, but then this very rich, deep co-design process that occurred with community and including lived experience voices within that. So at a systems level, when we said, well, what is the system trying to achieve and what is a good outcome? I think we really deeply listened to people on the ground, including both, service delivery and service users to help define what that means. If I read that question, I think it's multifaceted because I think it potentially also speaks at an individual level. Like, how do you decide as, a family member that you've achieved that goal, and how does a practitioner kind of make a judgment of that? And the answer to that one is much more about good relational practice and forming a strong professional working relationship between practitioners and families, having open, honest, transparent conversations from the outset around what the concerns are and what the goals are, regularly kind of checking in on those and reviewing those, and reaching a consensus point at the end of a period, which I don't think I mentioned, just for people's context, is often 6 to 9 months worth of time that a practitioner might be working with a family. So, there's two answers to that. One, it's done at a policy level through consultation and lived experience, but at an individual level, it really is about relational practice and honest, transparent, open conversations.
Jess or Ryan, did you have anything you wanted to add about how to define what success looks like?
Yeah, I just wanted to, I guess, point to maybe this is like a more specific and technical example of this. Maybe not exactly what you're saying, Thea, but with the relational contracting, there's also outcomes in the sense of like the performance indicators that are used to drive like the behavior of service providers and things like that. And so from talking to both the service providers and Henry and others in his team, like I heard about how DHS does work with service providers to create performance indicators that are actually useful, like bringing in the data, like for example, we talked earlier about engagement rates and things like that, but also listening to service providers to like what performance indicators are actually improving their practice, like what is the right timeline for them over which they can achieve and meet a certain target, and finding kind of a middle ground where there really is that flexibility where it's not government saying you have to do this, we know best. It's genuinely working with the providers to find that right middle ground that's going to create the best practice on the ground and create the best outcomes, achieve the best outcomes.
If I can really quickly riff off that as well and just add to it, I think the KPI one is a really good example. And just in practical terms, You know, these services were all redesigned in about 2020. I think I've said that already. In 2025, we literally threw out all of our KPIs and set a whole new set of KPIs in place, because we realized what we were measuring just was not telling us anything linked to the outcomes that we were ultimately trying to achieve as a system. The reason we're able to do that is because we were understanding all of this evidence along the journey, and we're able to reach this point where we were all in collective agreement that actually those things we're asking you to report on, they don't matter. They've got nothing to do with the outcome we wanted to achieve. And we want to start focusing over here on these things now. Are you all comfortable with us doing this? It's a major contract change. We're going to completely change your KPI structure. And everyone was in total agreement. So I think it is a nice little example of that.
Yeah, I really think that question of kind of the trust that you're changing things to get a better outcome, not to kind of screw them, is like actually a really important part of that kind of contracting process. Jess, did you have anything you wanted to add on kind of how you know if the system is working better? Like, what do you think the good outcomes are?
I was going to say what's great is really working alongside that family on the ground to find out how they're feeling. Have they increased capacity? Do they feel like they can venture off without the support of so much services behind them to be able to continue their journey on their own? And providing a way where families can provide feedback towards a service or a practitioner that allows it to remain unbiased and really authentic to that family's experience. And teaching them how to analyze the small steps is really successful wins, because sometimes I think families come in and want to move mountains, and absolutely, yes, we want to do that for them, but they need to also acknowledge those small improvements that they've made over time, because that's building the really solid foundation that they can indeed move mountains later on. So yeah, capacity building, giving them time to reflect, teach them how to, celebrate those small wins and how that really is success, I think is paramount to being able to ensure that this system is working the way it's meant to work.
I love that. And I think the next question might come to you, Jess, in the first instance as well. So it comes from Penny Markham, and she's asking, what are the key ingredients that enable people with lived experience to actually have meaningful impact without it being kind of tokenistic? So what's the magic sauce here?
Honestly, our advisor that we have on our LEN board is incredible. Paula is just wonderful at ensuring our safety, and making sure that we're in a healing part of our journey where it's safe for us to share our experiences. A lot of the time, we're not trauma dumping in this room. We're not throwing down everything that we've been through, but we're really using that to guide and provide feedback and clarity about what could be done better. And I think that that is so important. So having somebody really safe as someone when things might feel a little bit rocky or we may be triggered, we got to understand we're working in a room of people with a variety of really traumatic experiences. So ensuring that we're doing our very best to keep them safe, but also giving them time and space to open up. We could be in a meeting room and it's not required for us to talk. It's not this expectation that we have to go in and fix all of the problems. And if we feel like we can't contribute or it's slightly too triggering to us, it's not something that we have to speak to. And I think not having that pressure and not feeling like it's forced, allowing it to feel really genuine. And I believe that everybody in that LEN room really has a sense of camaraderie within there. We all work so hard at supporting each other and celebrating our wins within the room as well. So creating that really safe space, I think, is that special sauce to really be authentic and challenge how the system's currently working.
Oh, I love that. And just to say, when we started conceptualizing this case study, the very first thing DHS kept saying to us, because I was all about the data nerdery, and they're all like, no, you need to go talk to the Lived Experience Network. So it was so clear that it was such a priority in their thinking as well. They really value it. I would like to throw to our next question from Alice Corrigan, who says, what is the typical intensity of visits, contact with families during the 6 to 9 months of work? I reckon that's a new one, Henry.
It is, and I did pop a little answer in the chat for that one as well. So I kind of glossed over when I was speaking, but yeah, 6 to 9 months of service delivery. We talk about this is high intensity services here that we're talking about. it's in home and an average of 4 hours per week that a practitioner might be supporting a family. Now, that doesn't necessarily mean 4 hours per week sitting down face to face. There might be some phone follow-ups and other types of supports. But yeah, on average, it's 6 to 9 months, 4 hours a week. So it is pretty full on, and it's I think I say that to kind of emphasize, I guess, the degree of investment that's going in here. But more importantly, that is a big burden on a family who are facing a number of challenges in their life. And again, I just really want to pay, acknowledgement to, respect to our practitioners who are going out there and finding ways to do this in a way that is supportive and engaging and inclusive, and not seen as, government just coming and putting more burden on families who are already faced with a whole lot of challenges. And I think, Jess, like, just to really acknowledge the influence that Lived Experience Network has had in helping CFSS to shape its practice approaches, I am very confident we would not be able to do that work in the way that we do it at that intensity, but in such a kind of inclusive way without the input of that network. So.
All right, I'm going to throw one to Henry, but word you up, Ryan, that I'm going to ask you the next one. So Henry, I'm going to ask you about whether we've thought about supporting families even earlier. I think you might have some good things to say about that. And Ryan, I'm going to ask you about, can you talk about what the learning is? Who is learning? What are they learning? How do we know that they're learning? But Henry, over to you. Are we thinking about even earlier?
We definitely are. We've got a number of kind of pilots on the way to open up earlier referral mechanisms. I could get into all sorts of really nitty-gritty data points here. I probably won't in the interest of time, other than to say the earlier the better, really. And whether that's kind of early in the life course of the problem or early in the life course of the child, both aspects are important to consider. So our data points a lot to, first-time parents, pregnant parents, young infants, all of which make up a lot of our priority cohorts, which I think were in the case. I can't actually remember if we talked to the priority cohorts in there or not, but you can find it on our website if you can't, if it's not in there. But just this notion of being able to get in earlier and put supports in place and scaffolds in place before a problem becomes too big. And I think here in South Australia, we've got a child protection department who are really strongly promoting a message that everyone agrees with, which is child protection is everyone's business. And what that means is that we don't want a system where things have to get so bad that it's getting screened in by a statutory organisation to prompt a service response. We do want to be able to respond earlier. A lot of our data would suggest that idea of kind of young parents, young children as real prime opportunity points.
Yeah, I really I like also the framing of early in the life course, not just early in the kind of specific crisis a family is experiencing. And I think that helps you kind of create a good triage list there.
And sorry, can I just add one
yeah.
other point? Sorry, I know you wanted to move on, but it's just reminding me as well. The other beauty of our learning system is, like, we can look at things like those priority groups and understand, actually, when we do prioritize them, how does that work out? And so one thing we can do is say, all of those groups I just talked to, we do prioritize them. They are getting increased rates of services relative to the general referral base. But the beauty of the way that we've set this thing up is that we can then say, and we on average have better outcomes with them as well. So there's this kind of amazing feedback loop where it's like, well, they're presenting with risks that suggest we should intervene early. We're now able to process and target them. And actually, when we do, look, we're achieving better outcomes as a result. So it's just such a beautiful example of how you can use that to then feed back into policy world to shape people's thinking and understanding. And we can use it ourselves in terms of service design as well.
Oh, that's brilliant. So Ryan, maybe take us through a little bit about the learning mechanism, who's learning, how, etc.
Yeah, so there's really a whole range of different mechanisms, so to speak, but I kind of organize it in two halves, right? So one is how the learnings are generated. So in other words, figuring out what works. And like I mentioned before, that's a combination of different things. You have the data systems that Henry has talked about, tracking all that data, all that linked data, analyzing it with epidemiologists. You also have the lived experience network. So they contribute their insights in various different ways that Jess mentioned earlier. You have the practitioner insights, and including Aboriginal and Torres Strait Islander practitioner insights through ACCOs and things like that. And that comes up through the contracting conversations back to DHS. It also comes at the communities of practice where, yeah, practitioners are able to discuss things more in that sort of peer-to-peer sort of way. And so like those are some of the different ways that the learnings are generated and kind of synthesized from different sources. And then they're embedded back into the system to improve practice, once again, in lots of different ways. Some of it is through the contracting conversations I mentioned earlier, so like adjusting the KPIs or just, DHS having a conversation with a service provider about like what is the best way to go about this, what's the best underlying mindset or way to think about this to achieve the best outcomes. Another way in which the learnings are embedded back into the system is through the sort of practitioner resources DHS has. So they've produced, Safer Family Services, which is the government service provider that Henry mentioned, takes like 50% of the system, have produced a whole range of practitioner like resources and frameworks and things like that. And once again, Lived Experience Network has fed into some of those. So it's like another way that learnings are embedded back into the system. There's also those communities of practice that I talked about, like the biggest example being the kind of statewide forums they have with, hundreds of practitioners. And once again, that's a way for, they bring in experts, they bring in the lived experience network, they share the data that they've had and allow practitioners to talk with each other to process that. So it's kind of this range of different mechanisms that are both sort of figuring out what works and then in a lot of different ways continuously feed that back into practice itself in all those different pathways. So, yeah.
Yeah, and maybe it helps if we just kind of sketch the picture of what it looked like or what it sort of notionally looked like before. So before, DHS held a range of contracts with non-government providers and it had its own service doing something like Safer Family Services here. And while there was obviously on the ground, we know practitioners are good and they all talk to each other, there was no kind of systemic way of bringing people together. And so what that tends to do is it tends to lead to a lot of like, oh, they're not very good at this, or if only they would start doing that. And there was no kind of virtuous cycle of remembering no one's doing this work for the money, right? Like people do this work because they want to make a difference and because it's really purposeful and meaningful work. And so this is like harnessing that sense of shared purpose and then giving actual mechanisms to do the shared purpose things together. I think because we've been doing a lot of stuff on the kind of the softer side of the practice side, the lived experience side, it is just worth saying the data side is, I think, from my perspective, what unlocked the money. It's what unlocked the resourcing. It's what unlocked, for example, the institutional willingness of education to kind of let those family practitioners go from children's centres, because you actually do need to be able to prove to some hard-hearted wonks at some point in time that you are going to see outcomes captured on a spreadsheet. So I think that's the kind of brilliance of this, is it captures it all. We have 6 more minutes. I'm going to ask one hard question and then one easy question. The hard question, maybe it's not hard, is for you, Henry. Have there been any providers join or leave since CFSS was initiated, and how do you manage that process? Because we've got people online who are managing these kinds of contracts. Like, that's tricky. Any advice?
Look, no, we haven't had a lot of providers leave. We have had some small scale restructures to some contracts that we've had to work through, and I guess we've approached those with open, transparent, honest conversations around the rationale for doing so. And it's only ever been from like a policy perspective that we've had to make those types of decisions. So we've never had to kind of manage someone due to performance or something like that. That just hasn't been a thing that we've dealt with. But I think that's important in itself. The reason that hasn't happened is because of the learning approach that we've adopted and the fact that we've been able to provide people with kind of continuous insights into what we're seeing, but also what makes a difference, to be able to boost, increase performance in areas that we might have had some concerns around. So no, we haven't had to deal with any people leaving. We certainly have dealt with new providers coming on board as new programs have come on. I mean, that's not a hard question at all. That's just like a big love-in, because we bring them into this learning approach and people are just so excited to be a part of it, I suppose. So that's about the easiest question I could deal with, I think. But it is, I guess there's an element to that which is important, which is there is some onboarding and things like that to do to make sure that people do understand what's being asked of them in terms of providing data, because your system is only as good as the data that you put into it, you know? And so data quality is such a fundamental, boring conversation that typically we won't focus on, but it would be remiss of me not to mention it, because a ton of effort goes in behind the scenes to make sure that people are putting in quality data that we can actually have confidence to rely on what we're measuring as an outcome from it. And so that's probably the biggest effort when new providers come on board, actually, is getting them up to speed with that side of things.
And can I
Lovely.
just add
Okay.
just quickly to the very last point about the importance of quality data? Like something I heard from some of the providers I spoke to and also Safer Family Services is that people are way more willing to put in this data, like the caseworkers on the ground, if they know it actually makes a difference for them. Like when they see at these communities of practice, oh, this data I inputted ages ago has actually like discovered a better practice and actually came back and improved the way the system works. So I think that's like another thing to really point out when it comes to the importance of that really high quality data collection.
Lovely.
Can I add
yeah,
quickly as well? So sorry. Having that data as well really helps shape Len, knowing that our time and our experiences within this room with our fortnightly meetings are actually heard. And so we refer to it as closing the loop. So when we give advice to practitioners and different services, when they come back and go, this is what we've heard, this is how we're implementing that. Look, we've heard this, but we can't do that due to these reasons, but it is in the back of our minds that this is a question that you have raised. So having that data even returned to us in Len helps raise our voice to know that we're being heard and our experiences and opinions really matter. So it's definitely important.
That's brilliant. So 3 minutes left. I'm going to do a quick fire rapid round. We have a beautiful question that this really sounds like a big shift in culture. And there's been challenges in changing the culture of service delivery organisations and government. And the question is, what's your number one thing that's been helpful, or what do you observe from it that's been helpful in changing culture? Like, what's the number one thing that's been helpful? I'm going to start with Henry.
To me, it's about measuring and shared reflection on the learnings of those outcomes that we're measuring, and then doing that through kind of those relational contracting mechanisms that are so beautifully written about in the case study. Thanks, Ryan. I think that builds trust and confidence that we're trying to work towards a common outcome and a common goal. So that, to me, there's been a number of specific examples I could give, but underpinning the way we achieve the change is always through those approaches.
Yeah. Jess, what's the number one thing that you think's changed, like that's been driven the change that you're here? What's the big factor?
I think is the openness to change. Honestly, just having the policyholders and stakeholders really listen and value our experience and how can they implement that better within services to really encompass families when they're reaching out for that support. If they didn't have the willingness to change, then we would feel silenced once more. So having them really open and valuing our experiences pushes us to keep going.
Oh, beautiful. And Ryan, number one thing?
I think when I asked all the people I spoke to for the case study, the most common answer of like, how do you shift culture, was that it really comes down to leadership and having leaders that are really dedicated to doing things differently, you know, being willing to accept feedback and acknowledge changes, acknowledge that change needs to be made. And then that feeds down throughout the whole organization.
That's beautiful. Look, there are still some beautiful questions on the chat line. Penny Markham asking about a practice framework. There is. I have seen it. I'm sure Henry can share it with you. Cheryl Yerton asking whether we've had reticence from people joining the learning system. I think Henry would say not reticence, but it's been a journey, hasn't it? But I am just so grateful for everyone joining along. Please download the case study. I know Ryan is happy to come and talk to whoever might be interested in it. And for those of you kind of really interested in the kind of practice questions, you know, I'm sure you can work out Henry's email address from the internet and contact him.
Yeah, I was going to say, people are welcome to look me up on LinkedIn or find my emails and get in touch. Happy to follow up on some of these questions about what we're doing.
That's brilliant. Look, thanks, Jess, Henry, Ryan. You guys have been a delight. And thank you, everyone, for joining today. Cheers.